is Julie McCrossin, and I'm a 12-year survivor of head and neck cancer. And for World Cancer Day, the 4th of Feb 2026, I'm welcoming Dr. Richard Gallagher, an ear, nose and throat surgeon from Sydney, Australia. Welcome, Richard. Now, you've just used, for the first time very recently, the Da Vinci single port robot for surgery on a head and neck cancer patient. And I want to hear about that and share that with the world because it's good news for patients. So what is this new robot? How does it differ from the other one you've been using for a few years? And why is it good news for head and neck cancer patients?
I think probably the place to start is that the robot that we've been using, the Da Vinci platform, and that the robot that we've traditionally been using really ever since I did started doing those operations in 2011, was what we call a multiport robot. So it had multiple arms. And if you remember the pictures, this was quite a big robot. It had these arms that came in, and we used 3 of those 4 arms for the operation. But we were going into a tiny little space. So we're going into the mouth and trying to go into the throat, and successfully, mind you, but with these large instruments. And that made, so technically that was always difficult, but it was something that we could overcome. The single port robot differs in that it's instead of having these 4 arms, it's essentially one port, and it's about 10 centimeters in size. And within that port, there are 4 instruments, including the camera. So there's a flexible camera that comes out, and then there are 3 other instruments. And the beauty of this is that the instruments are smaller. They're coming out of one port, so we're not having to put multiple different things into the mouth. They're all going straight in, and then they expand, and we can work within quite a tight space. So the advantage is it's more, at least I believe it's going to be more precise and more accurate, and is going to allow us to do some surgery I think that people have found generally pretty difficult to do further down the throat. So for that reason, I think it's a great innovation. It's being used in the United States and Europe for quite some period of time now. And in Australia, here at St Vincent's and the Epworth Hospital in Melbourne, we've both got a single port robot, and both started using the robot.
Could you give us a sense of the key types of cancer in the mouth and throat, and perhaps lower?
Yes.
How be able to be treated with more confidence because you're able to work in a smaller space with more precision?
We were already doing oropharyngeal cancers, which is the big group of HPV-related cancers that we all know about, and the ones that are the most common or more common. The tonsil cancers of the tonsil and cancers of the tonsil tissue on the back of the tongue, the lingual tonsil or the tongue base. We were able to do that with the multi-port robot, but it was always quite difficult. With the single port, I believe that is going to be easier, particularly accessing the tongue base, so that we have a bit more, we have smaller instruments in a small space. So essentially we're opening up the space in a way, even though it's not changing in size, but the instruments have got smaller and the way that they go into the mouth. And then what I think that will make that surgery more accurate. And that's now I've only done one case. I've done my first case and it went very well. And I was happy with that. And it took me exactly the same amount of time as it took me to do a multiport robot operation. What I think is that it's going to allow us to do some operations a bit further down the throat. Now, these operations we've been able to do in the past, but they're very difficult, and someone has to have great mouth opening, and there has to be really good access to get down beside the voice box. There's a technical area called the hypopharynx, which is an area next to the voice box, part of your throat, where you can get cancers. And also there are cancers of the voice box in the area above the vocal cords. And this will allow better access, and therefore will open up those operations, I believe, to a bigger group of patients. Because even though the access may be a little bit more difficult with the single port, the access it'll open up that access of those patients who may not have been candidates to have surgery done. And the advantage being that we would hopefully, they may not need to have any extra treatment with radiotherapy or chemotherapy, or they may still need to have other treatment, but they have less treatment than what they would require previously.
Will there also be patients who get access now to this kind of robotic surgery down through the throat who could previously open their mouth wide enough? Because I seem to remember when I first met you, you told me that you thought I wasn't able to open my mouth wide enough to be eligible for the older robotic surgery as a head and neck patient.
Definitely, I think you're right. There are a subgroup of patients who have their mouth openings not fantastic, and will allow the single port robot will allow us to access some of those patients. One of the problems that we have when your mouth opening is not very good is it's really got to do with the instrument that we put in to hold the mouth open. Even though we may be able to, even though the access might be slightly less, I believe that with a single port that we should be able to access some patients that we couldn't offer this to before, because even though the mouth opening is a bit less, even with the mouth gagging or the instrument that we use for the operation, we should be able to get the instruments in more easily and work within that tighter space.
Richard, you mentioned that this has been used in Europe and the United States for some time, and I think you've been in Strasbourg last year doing extra training on this. I guess I'm interested, is there any indication that the recovery time and the side effects for the patients may be less with this single port robot?
The work that's been done certainly shows that there's equivalency in the success of the operation, the curing of cancer. So it's at least equivalent. I'm reluctant to say that it's better at the present time because I don't believe that there's enough information out there to make that statement. But it's at least equivalent. The time of the operation is at least the same or less in the hands of surgeons who do it frequently. And the complication rate is less. It's the same or less in what I've read of overseas information and talking to people from overseas. So there's still always going to be complications that we worry about with this surgery. We always worry about these things. But I believe that there are some advantages in this robot which will ultimately show or come through showing that I think that this is a better robot for these operations with a better outcome for the patients. I actually believe it'll be a better outcome for patients.
Look, just finally, it's access to this single port, Da Vinci single port robot. Is there anywhere in the public sector in Australia where this single port robot is available at the moment?
There's not. Here at St Vincent's, it will be accessible to those patients. We've had a relationship between the private and the public hospital where patients who require robotic surgery who are public patients can get access. And I believe that we'll be doing the same thing for the single port robot. Otherwise, at the present time, it'll be a slow rollout of the single port robot. Of course, these things are expensive. There's a robot already available that people are using, and it'll take a number of years for this to become more widely spread. It will make a difference, though, and of course, it'll be important that it gets introduced across the spectrum of healthcare facilities.
Dr. Richard Gallagher, thank you so much for giving us a Da Vinci single port robot update, and particularly for head and neck cancer patients. It's just such good news because obviously the alternative surgeries are quite heroic, aren't they, when you can't go into the mouth?
Absolutely, and looking at having to do operations of the old operations that I was trained in doing and that I did for many years of splitting someone, making a cut through a cut through the lip, splitting the jawbone, having a tracheotomy, having a feeding tube, having tissue taken from another part of the body put in, and then spending weeks in hospital with lots of potential complications. It's a good thing that we really don't do those operations anymore. They're very infrequent.
Thank you so much, Richard. And I say happy World Cancer Day because we're improving our care all the time. And it's just fantastic to hear about this innovation. Thank you.
That's right. Thanks, Julie. Thanks for having me.